Hello, my name is Dr. Kağan. I'm from the OS Clinic and I would like to give you information about the implant treatment today. Now, we do lots of implant treatments and all the people asking lots of questions about implants, how you get them, how you want them, how the results gonna be like, and I'm gonna give you some simple information about the implant treatment today. Sometimes patients, when they reach us, they send us the photography of their mouth, but for the implant treatment, this is not enough for us. We have to see the X-ray, something like that. And when we see the X-ray, if there is enough bone quality on your mouth, so we can tell you that we can do implant for your mouth and we can continue the process. But there is another detail that we need to talk about. These X-rays are like 2 dimensions X-rays, so it's like just a photograph. But in the implant treatment, we need 3D X-rays, so it's called tomography. So we can see the thickness of your bone and the length of your bone. So we can plan to which implant size we're gonna put on your jaw. That's the most important thing in the implant treatment. So when you come here, if you don't have enough bone, unfortunately, sometimes we cannot put the implant straight away. So in these situations, we need to put bone grafts. And sometimes we don't have to put the bone grafts because there are different techniques that we call Allon 4, Allon 6 techniques, which means you put the implants like angled way, not the straight way, like the angled way, the one that you see behind me. This is another patient of ours, beautiful Ianina, and as you can see, there are sinus holes here in the patient's mouth. There is no enough bone here to put any kind of implant. It's like 2 millimeters here. So what we do for her is just Allon 4 treatment. Is basically we put the implants like sideways, angled ways. So we just keep that implant away from the sinus, and we put the 4 implant on the top jaw and 4 implant on the bottom jaw. So we need to hide away from the nerve here. So 8 implants, you can get full mouth treatment, and this is gonna be the result with the Allon 4 treatment. This is the patient's final treatment. If your mouth is suitable for that, yes, we can do Allon 4. But sometimes patient has more than that, and in this situation we do like Allon 6 treatment or just a straight implants. This is a good example for this. In this area, in the sinus area, the patient has enough bone, so we put the implant straight away. But in this area, it's not like very good, so we put the implant like angled way. On the bottom, it's all good bone density in there and all good bone level, so we put all the 6 implants like straight. So all the times when we put the implants, if there is enough bone, we can put it in every way, and the results with all these treatments are all gonna be amazing like hers. And sometimes when the patient reach us, they have full mouth healthy tooth, so we don't have to remove all of them. These Allon 4 and Allon 6 treatments are for generally the people has no tooth in their mouth, so we do the full mouth constructions. But if you want to do just the back part of your mouth, so we don't have to take it all out, so we need to put the implants in the back area. This is another beautiful example of our patients. So when the patient came to us, she had really problem with the back teeth, so there was nothing at all, like 1 millimeter thickness bone here, it's all sinus here, it's all empty, but we cannot take these tooths out because they are healthy, so we have to put the implants in this area. In this situation, first what we do is sinus lift, called sinus lift. It's basically a bone graft operation. We open the sinus here, we put the bone graft inside of the sinus, so we can have more bone in this area, which is gonna be like this. This is the after operation X-ray. We filled this area with the bone graft and we just leave it for healing, like 6 months at least. During the 6 months, the bone connects with the bone graft and it creates new bone structure. So we can put implant in this area. After 6 months of healing, and the patient comes to us like second time, and after that we can put these two implants in this area. So we got our knee bone, healthy bone. So we got our implant here, and just gonna leave it for another healing process, which is gonna be like 3 months, which our implant will connect with the bone graft, actually knee bone. And then when the patient comes, like after 3 months later, and we can put the crowns over the implants. So when you get this kind of treatments, it sometimes is like 2-stage, sometimes it's like 3-stage, sometimes even the most difficult case can get up to like 4-stage. So it's special treatment for everybody's mouth. So we need to see your x-rays, we need to see your photos, we need to see you detailed when you come here, and after that we can plan all these treatments. Thank you.